Australian Medical Association is demanding free rapid antigen tests for all. The organisation says the tests are an essential tool for disease control and everyone should have access to them. Joining me live is the Australian Medical Association President Dr Omar Khorshid. Good afternoon to you, Doctor.
Good afternoon.
Well, National Cabinet agreed to free rapid antigen tests for concession card holders yesterday. Was that enough?
Look, it was certainly a step in the right direction. And even more importantly than that, those people who need to have a rapid antigen test instead of a PCR, because they're a close contact, will also be provided with free rapid antigen tests, regardless of whether they're a concession card holder or not. But it would certainly be better if all Australians had equal access to these tests when they need them, because the government said we're living with COVID now. There's going to be COVID everywhere in the community. They're asking people to look after their own health. And one of the tools needed to do that is these rapid antigen tests, and therefore they should ideally be free.
You look at other parts of the world, the UK or the US, these at-home kits, they are free. It feels like we're scrambling to catch up here again.
Well, we are scrambling to catch up. And of course, our biggest problem is supply of these tests. We simply don't have them. And to be honest, people wouldn't be too worried if they have to pay $5 for a test if they could get one. But right now, they're very, very hard to come by. So that's the biggest problem. But of course, we have missed an opportunity to plan ahead to work out how to use these tests, when to use them, how to collect the results from them, and of course, how to procure them and distribute them. These are all things that have been thought of over the last few months, but it seems that opportunity to actually put in these plans has not been taken by our national government. They've left it to the states. And yet again, we've fallen a little bit between the cracks, and here we are. At the time we really need these tests, we're still actually waiting for them.
Well, it's somewhat perplexing, isn't it? Because the AMA, correct me if I'm wrong, was flagging this back in September. The Transport Workers Union was saying they needed rapid antigen tests in October. The Prime Minister's saying, well, the states, you could have been doing this yourselves back in November.
Well, they certainly could have been, but yet again, without proper national coordinated action, without a Centre for Disease Control or someone like that really has not just the authority, but I guess the job to get out there and think of all the things that need to be thought of, think of what is the next challenge ahead, get those plans in place so that when the challenge comes, we're ready to meet it. We don't have that. We're relying on our political leaders, our state and federal governments to work together in ways they've really not done in the past. And at times it's worked, at times things have slipped between the cracks. And I think these rapid antigen tests, it's fair to say, have slipped between the cracks in our rather complex system of government.
Is Victoria moving in the right direction, do you think, in terms of incorporating rapid antigen test results into the daily figures and also the process in which they're doing that? They've just announced it. We're seeing similar things in the UK with their barcodes. You scan that. Do you think that's something really that should be implemented across the country?
Yes, we absolutely believe that these rapid antigen tests provide valuable data. It's valuable for the people running our public health response, so they know how many cases are out there in the community, or at least have some measure of that. But also, if you've got a positive test, it's an opportunity to link that person to the services that they need, to the specific advice for them, and to where they can go should their symptoms deteriorate somewhat. We do, of course, need to also be talking to everybody, but not everyone listens to health messages until it becomes really relevant to you. And the moment you test positive on a rat, that's the time you really want to know what's the next step. And without a kind of specific way to get that information, people are floundering a little and wondering what's their next step, turning up to EDs, turning up to GP practices where really they don't need to be.